Before we kick off tonight, I'll just let you know that this is not medical advice. What I'm sharing with you tonight is information. It's things I've learned over the last 36 years in clinical practice. And if you're on medications or you're following a program with your own practitioner, you keep doing that. This is information. So I just wanted to be clear about that. I wanted to do this little talk tonight because I have had so many of my patients contacting me over the last week to 10 days about the colds and flu that's doing the rounds at the moment. They're quite fearful, some of the patients, because, you know, you've heard about what's going on. There's been quite a few deaths. So tonight I'm just going to talk about what you can do at home to help your family stay as well as possible during this winter, this cold weather. And I know you've seen the news about the deaths in Victoria. I'm in Sydney and I haven't seen any news about flu deaths up here, but on the government pages that they've got them listed. I did try to get more information about some of these people that have passed away, and the majority people seem to be older people from nursing homes. I can't get any information on how healthy these people were or whether or not there were some underlying issues apart from old age and all that goes with that, that did make them more vulnerable. So my information that there's at least 228 people that have died from flu-related complications around the country so far. And it is early in the winter, isn't it? Here in New South Wales at the end of last week, there were a total number of flu-related deaths that were 57 people, and of those, 47 were from nursing homes. But again, I can't find any information on any of the others. So they called them flu-related complications that have occurred that have caused these people to die. So what are these flu-related complications? Well, you would know you get ear infections and sinus infections, particularly with young kids. They can't blow their nose properly and so on, so their sinuses can block up quite easily. And the more serious complications, of course, are bronchitis, you get viral or bacterial pneumonia. Dehydration is also a complication that's not often thought of, and that's particularly in the elderly because, you know, they're often alone and they do forget to drink. They go down, lie down, they're tired, they feel crook, and they forget to get up and drink. And also anyone suffering from a long-term illness can be far more vulnerable to the flu. Conditions like heart disease, asthma and diabetes, and of course anyone on long-term medications because of side effects or the vulnerabilities that these medications can cause in your body make you a little bit more likely to have a flu that affects you more adversely. However, always remember, even if you're really healthy, never take a dose of the flu lightly because it can have very serious complications, obviously. So let's see how you can tell if you have a cold or if you have the flu. So a runny nose, nasal secretions, eyes watering, very rarely a flu, it's usually the common cold. Sneezing is usually a common cold, not the flu. And by the way, there's over 200 cold viruses that we know of, and I'm sure they'll find more as these things keep mutating. So there's a lot of common cold viruses out there. Sneezing, runny nose, common cold. Sore throat, both. You can have a sore throat with the flu or with a cold. Fever is generally with the flu. You can get a bit of fever with a cold, but generally your higher temperatures will come with the flu. 38, 40 degrees. Temperature can come on suddenly, like you're okay 1 minute, or you might just feel a bit tired and washed out, and then suddenly you're really hot, you've got a fever. A cough is common with both of them. Again, in flu, it's often quite a sudden thing, whereas with the cold, it might take a couple of days to sort of, you just cough a little and then it gets worse. The headache is very common with the flu, but not so common with a cold. Aches and pains, of course, this is the real big one, isn't it, with the flu? You just feel every bone in your body is aching. You just can't stay up any longer. You've got to go to bed. But it's quite rare with the common cold. You can get aches and pains with the cold, but nothing like what you get with the flu. And fatigue, of course, fatigue is very common in both of them. You just feel really wiped out. It's a little more intense when you've got the flu, but you still feel it with the cold. And for some, particularly in kids, they can get a bit of nausea, even vomiting. It's a bit rarer in adults with the flu. Doesn't often happen with common cold. And sometimes with the flu, kids particularly can get a bit of diarrhea or tummy aches. Now, I had an email question sent to me from Anne, and she said, I went to the doctor and was told I had the flu, but just go home and rest and keep my fluids up. My question is this: how did the doctor know I had the flu when he didn't do a blood test or throat or nose swab? And that's a really good question, isn't it? Because so often people will say, oh, I've got the flu. They really don't. They've really just got a cold. And I think we're confusing, some of the symptoms of a cold and some of the symptoms with flu. There is a virus. It's called adenovirus. It is a cold virus, one of those couple of hundred viruses. And it actually has very similar symptoms to the flu. So it causes fever, headaches, really bad body aches and pains, and breathing problems. So it's very easy to sort of go, oh, I've got the flu because I feel so bad, when it can actually be the adenovirus. So my sense is perhaps we're seeing this virus more often, but it's just being labelled as the flu. I don't know, just saying, right? The only way we could tell what people are suffering with, of course, is to have a throat or nasal swab taken for everybody. So that would give you exact figures on how many people are getting the flu and how many people have a cold. And of course, that doesn't happen. That just doesn't happen. The thing too to remember with the flu is that you are contagious from one day before you actually become symptomatic. So you're running around, you might feel a bit off, but nothing in particular, but you're actually contagious. You've got your flu bug, and the next day or so you actually get really bad symptoms. And then up to 5 days after you become sick, you're quite contagious. So it's really important to stay home. Keep your kids home when you've got a cold or the flu. You're just spreading it. So rule of thumb here, stay home so you don't keep spreading these viruses around. Easier said than done, isn't it? Everybody wants to be at work and not miss days and so on. But the way these bugs are spreading through the community these days, and it is very different now to what it was, or even 5 years ago. We have to sort of all step up and step back when we've got the flu, if you like. Now, a common cold is not a bad thing to have, and in fact, it is a way that the body cleanses itself, and it allows your immune system to become stronger. So every time you get a cold, your body is triggered, the immune system's triggered, and it fights off the bug, so your immune system becomes stronger. When people say to me they never get sick, they never get colds and flus, that's often a marker of a weakened immune system. People think they're healthier because they don't get sick, but it isn't always the case. And particularly, I know I do quite a bit of work with chronic illness patients who've got all sorts of chronic disease and even cancer, and they'll come in and they'll say, I don't know why I've got this illness because I've always been so healthy. I never get sick. And as soon as they say that, I'm thinking, okay, there's something chronic going on here. And it's usually the case as well. So what do you do when you've got the cold or the flu, and we're in the middle of it now? And there really are some simple and extremely effective things that you can do either at the beginning of the flu season or where we are right now. If you don't manage to sort of start early in the year, and really we should be starting probably around March, April to do preventative protocols so that we can prevent ourselves from getting anything. But the quicker you can get to treat the initial minor symptoms that will be presenting, the more likely you are going to be to stop these bugs in their track. When a cold does progress, keep taking these simple remedies. The less likely it's going to become a serious problem and drop into, one of the really serious illnesses. And certainly recovery time will be quicker. Adults generally get 2 to 4 colds a year. Now, this is actually not unhealthy. And in most cases, by the time you're 60, you'll only get 1 or 2 colds a year. And sometimes you might not even get that. So after 60 years of living on our planet, we seem to have developed some reasonably good immunity to the common cold. There are hundreds of these colds, the bugs around. Only a few influenza viruses, but hundreds of cold viruses. During winter, children are particularly vulnerable. They generally have around 6 to 8 colds every year, and they can have as many as 12 colds a year when they first go to childcare centres or schools. And, if you're a parent, your child seems to have a constant runny nose, bit of a cough. So while their little immune systems are trying very valiantly to develop and strengthen, it's a little bit like a health yo-yo for them. They're okay, they're not, they are, they're not, for a couple of years. Newborn babies certainly have a much higher risk of getting a cold or any other bug that's floating around, as their immune system is very fragile and functionally still quite underdeveloped and certainly immature. Babies are completely reliant on the immunity, natural immunity, passed to them during pregnancy, and on the continued resistance from their mum if she's breastfeeding. So one of the very great benefits of breastfeeding, of course, is continually passing on your immunity to your baby. Babies always get good protection from mums, as long as it's a natural immunity and the antibodies that they receive whilst in utero from their mum, particularly during the final 3 months of pregnancy. And it supports them for several months after birth, and the breastfeeding, of course, very important. Tiny toddlers with very little exposure to the 200 plus cold viruses that are in our environment, they can come down very quickly. Like 1 minute they're running around and they're okay, and the next minute you go, gosh, something's wrong here, without very little warning. And it can develop into quite a moist bronchial cough and a sore throat or ear infection quite quickly for these little tots. Some experts believe that children's immune system's not fully developed until they're around puberty, and they reach the adult levels of antibody formation. So certainly by that age, they would have already been in contact with many of the cold viruses, and they generally have much better resistance. And if we can get babies and children through these illnesses without having to give them an antibiotic, unless absolutely necessary, and clearly if it's necessary, you take it, and certainly without giving them suppressive cold mixtures or other suppressive medications. If we can do that, we're helping them begin to build up their inner resistance, supporting their immune system as it matures, and helping their natural defences to develop. As a child's immune system becomes more robust, they will get less cold. And you know that. You sort of see, as they're tiny kids, they're always got something, and they get around 8 to 10 till they're about, 17, 18. They really can go for a long time with not very much going on at all, the mild colds here and there each year. And then when they get into, 18, 20, 30, I guess lifestyle and what they eat and drink might change a bit, and they become a bit more vulnerable again. What you don't want with all of these little kids, you don't want to suppress these symptoms because, it stops the immune system from doing its job. And sadly, the widely marketed over-the-counter cold and flu medications They're all designed to suppress the cough or dry up the mucus all day or all night, and it's just the opposite of what the body needs to do, so that it can clear the virus out and develop an immunity to it. Stay well away from these medications and drugs, and especially these suppressant drugs or over-the-counter medications. Don't give them to children. So basically, maintaining a healthy immune system, it's essential, isn't it, for being able to fight off the viruses. We all know that. Not just if cold and flu viruses, but any virus that's out there, and there are hundreds of them. So how do you easily keep your immune system ready to fight off the bugs? So I'm a herbalist and I love my herbs. So of course there's herbal medicine, and you can use these in tincture form, as a dried herb, as a herbal tea. Most health food shops and even some pharmacies, but certainly your health food shops, have a really good variety of dried herbs that you can put together and make a really good brew. So herbs like echinacea, olive leaf, golden seal, andrographis is an amazing herb, baptisia, cat's claw I love, nettle, fantastic, grow it in your garden. So it's like a weed, and it's one of our better immune herbs. Yarrow, garlic, elderberry, Siberian ginseng is awesome. Licorice, ginger, mullein. So there's some marvellous herbs that you can get and have reasonably easy access to. There's a great winter tea that I get my patients to make. It's lemon, ginger, garlic, turmeric, and some cayenne pepper. A little bit of peppermint leaf if you want to sort of give it a bit of taste, and some honey, and make it up like a cup of tea. Nice cup of boiling water with these beautiful herbs and spices in it, and let it sit and then drink it. Really delicious. And you can also make some gummies. Now, I don't know if many of you have made your own gummies with herbs and honey to sweeten it. And if you'd like my recipe for gummies, and it's delicious, just email me and I'll send you the recipe. Of course, there's lots of vitamins and minerals that you can use. Vitamin C, goes without saying, doesn't it? Vitamin C. So much evidence of how good it is for anything viral. Cod liver oil, this is a forgotten one. There's a lot of information about vitamin D and how important it is for your immune system, and it is. But cod liver oil, and it's got vitamin A and vitamin D. Tastes disgusting, but it's marvellous. It's really, really good. And, about 3 or 4 mils a day will really kick up your immune system. Homeopathy is another favourite, and there's many wonderful homeopathic remedies that work very well for colds and flus. Health food shops, certainly chemists don't carry many. Health food shops do carry some, probably a little bit harder to get, but certainly any health practitioner will be able to get them for you. And each remedy, each homeopathic remedy, has a value of symptoms that it responds to. So a couple of go-to remedies that I really love, and keep in mind with homeopathy, it is symptom specific, so it's a little bit challenging to get the right remedy, but not impossible. And there are some companies that will make a complex remedy for you with a few of these remedies. So again, if you want to know where to get some of these things, just give me an email and I'll be able to point you in the direction. So some of the homeopathics that I love: gelsemium, bryonia, baptisia, eupatorum. Oscillo is a remedy. Now, this is an interesting remedy, and it's in Europe. It's one of the biggest selling over-the-counter cold and flu remedies that there are, and it really does work. It's an interesting remedy. Have a look, Google it, and have a look and see what you think. But it does work very well, along with all those other remedies. And there are many, many more remedies that you can use for colds and flus. Tissue salts are one of the things that I adore. I love tissue salts. The 3 main ones for winter would be Fephos, Kali Mur, and Kali Salt. These are the go-to for winter. Last year I had a patient, and she had 3 young girls, 3 children, aged 14 down to 8, I think, from memory. And she put them on all of these 3 tissue salts plus my winter remedy. And in October, when they came back for a checkup after winter, the mum said this was the first winter ever that they haven't been on antibiotics. That's pretty significant, isn't it? A few herbs, a few tissue salts, and you can get through winter without needing an antibiotic. I think that says a lot. Aromatherapy, of course. I love oils, and oils like eucalyptus, lemon, lavender, lemon myrtle, thyme, sage, oregano. Beautiful oils. Something that I love is, I don't know if you remember the Vicks inhaler. You can get a little inhaler. I haven't got one here to show you, but I make one up for my patients, and it's just a little inhaler and you can sniff it, and it's they really work well. Patients of mine that are going overseas, I like them to take one of my sniffers because there's lots of bugs in the planes. Some foods, of course, that you need to keep up a little bit more perhaps in your diet in winter. Your citrus fruits, of course, red capsicums full of vitamin C, kiwi fruit, spinach, broccoli, carrots, garlic, ginger, all powerful immune support foods. And add crushed garlic or ginger to salad dressings and soups and stir fries. And one of the best immune boosters is mushrooms, shiitake mushrooms. And they can be added to almost any meal. If you buy them dried, you just soak them for 20 minutes and chop them up and chuck them into things. I make a tea blend with herbs and spices and a variety, a couple of mushrooms. It's really quite delicious. Probably doesn't sound that good, but it is actually delicious and really good for winter. Now, another remedy is, of course, onion and honey. So you chop up your onion, cover it with honey, and let the moisture from the onion seep into the honey, and you eat the honey. And it is delicious and really good. You can almost feel it doing some good as you consume it. Delicious. Remember too, your nose sprays, your salt water, saline nose sprays, especially for little kids. A sinus rinse, you can use a neti pot or just your hand, and gargle your throat with salt water. Do it twice a day. Really will keep the bugs away. Now, inhalations are really good. Just boiling water with a towel over your head, and you can put a couple of drops of eucalyptus or whatever essential oil you might like into it. Now, I always say to patients, get a dehumidifier to take the excess moisture out of the air. Now, most people will probably say, well, wouldn't you have a humidifier to put the moisture back? But I say, get yourself a dehumidifier. Take the excess moisture out and keep the moisture at a healthy level. And when you do that, have your inhalation so you're getting that beautiful steam going down through the respiratory tract, but the air in your house is balanced. It's not too heavy with moisture. And that's really important, particularly when you're fighting a bit of bronchitis or a chesty, rattly cough. So hot water inhalations 3 or 4 times a day, and keep your dehumidifier on. The dehumidifiers, they're absolutely fantastic. It's amazing how much moisture you get out of your house. And you know, one of the things that I really like about them is that it keeps the mold out of your house. You don't get the musky smell in your clothes and back of wardrobes and so on. It's really valuable. You do need to get plenty of sleep, so make sure you give yourself time to sleep. You do need to get some regular exercise. Now, this isn't while you're sick. You're feeling sick, you're not going to do anything, of course, but on a regular basis, 3 or 4 times a week, 20 minutes, just gentle exercise. Don't push yourself to the extreme. And I know that's a little bit of a buzz thing to do, but it's not good for your immune system. And if you've heard, these great athletes, they often have really terrible immune system because they push themselves to the limits. Gentle, regular exercise is a much healthier thing than a couple of extreme workouts. Practice stress management like meditation or just veg out on the lounge. What do they call it? Binge watching a series of videos. Fantastic. Just get your mind away from the day-to-day stresses. Just veg out. Goes without saying, don't smoke. People who smoke, or if you're exposed to secondhand smoke, you will suffer more frequently with flu, bouts of bronchitis, all sorts of things. And obviously, as much as possible, avoid close contact with people who are obviously suffering with an upper respiratory tract infection. Kids stay home from school, adults stay away from work. And the last thing, of course, wash your hands often, especially after you're out in public, you know, the shopping trolley and door handles on public toilets and so on. Ooh. Avoid touching your eyes, your nose, your mouth, your ears, because this is where the cold bugs get in, the viruses get in and infect your respiratory tract. So there's a few things. It's very simple tonight. 2 weeks from now, I will have a bigger talk on colds and flus, and there'll be a couple of other practitioners who will talk about their specialty with me. So if you want to go to my webpage, have a look for that. Let me just have a look, couple of questions. Crystal, how do we get your email? Yeah, good question. It's molly.knight. After this, I think I can go on to your question and give it to you, but it's molly.knighthap@gmail.com. But I'll make sure you get that. I'll comment back. Trevor, sorry, just reading this, guys. Could I ask your opinion on vaccination and immunity? Yep, several mainstream articles that state the flu vaccines are not entirely effective. Is it better to support the immune system with a good environment and good nutrition rather than rely on vaccines? Yeah, thanks, Trevor. Really good question. I was watching the ABC telly a couple of nights ago, and there was a doctor on, and he was saying how the flu vaccination is about 40 to 50% success rate, I guess. So I think, you know, if everybody has a look at that, they look at what's in the vaccines and how effective it is and what it can bring to you, then make your decisions. For me personally, I would like to make sure I keep my immune system as robust as I can, and have a good diet, and you know, take my herbs. I love my herbs. I make up some beautiful herb teas. Even my husband likes them. That's a miracle. Did you hear him laugh just then? Yeah, look, it's hard, isn't it, with the vaccinations, because even the doctors know that the flu vaccine isn't that effective. So it leaves you in a bit of a quandary. I just say to everybody, do your homework. Look at what these things are. Look at the stats about how well they work, and make your own choice. Choose wisely for your body, because that's important. And, you know, I honestly believe we all must be able to choose. We must be free to choose. And wouldn't it be good if we could have really free speech on everything? That would be something I would like. Okay, so a few people coming in saying, yes, please, they want my gummies recipe. Okay, I can certainly do that. No problem at all. Okay, I think that's about it for now. Thank you for joining me, and take care. Have a good winter. Remember, 2 weeks from now, I think it's the 15th, which is 2 weeks, yeah, 15th of July, we will be having an online little webinar, a couple of us practitioners getting together and giving you some really good herbal remedies with quantities of, you know, how much echinacea, how much golden seal, how much cat's claw, whatever, and how to put some herbal teas together depending on whether you've got a cold or whether you've got the flu or whether it's tonsillitis or bronchitis, whatever it is you've got. The other thing that we will be talking about is, that's a favourite of mine, is whooping cough, and how to deal with whooping cough, and particularly if there's an outbreak in the schools, how do you look after yourself and your family and get around these problems? So if you can join me there, just pop over to my webpage and have a look, and you can email me and join in. Thank you so much for your time. Thank you for joining me. I appreciate your time because I know we're all so busy. If at any time you have any questions and I can help you further if you get the flu or a cold, please feel free to email me. I'm truly always available. Good night for now. Bye.